from Len D'Cruz, who's the Senior Dental Legal Advisor at the BDA. So Len, are you ready to go?
Yes, I am, thank you. Hopefully you can see my screen. Okay, thanks. Good afternoon, conference. Thank you, Leah, for an excellently chaired conference, very unflustered, well done. And thank you for your invitation to address conference. So it's a short presentation on some dental legal issues facing practitioners during COVID. They're just going to look at a couple of things about guidance, what if I get it wrong, clinical records, indemnity about fit testing, and vicarious liability. So we've had a very short notice period to return to work, announced by the Prime Minister on the 28th of May, BBC, which conference already debated at length. This has obviously been the same across the UK. There was a plethora of guidance that landed in our inbox, and the motion from Jimmy before lunch, Nottingham, expressed exactly that particular issue. So that guidance came in no shape from SDCEP. That was first off the block, followed by the NHS, followed by FGDP, followed by the toolkit, and then followed again by the CDO's advice. So unsurprisingly, people were very confused about what to follow. The BDA's toolkit, which looks at both clinical and business issues, especially looking at issues like abatement and associate pay, unlike the other clinical guides, has been quite useful. And conference will obviously be debating that today as well. Yes, you can access this, as Mick Armstrong says. You have to be a BDA member. Essential membership only going to cost you £37 a month, so it's not too much to ask to get access to that particular guidance. The first point to make is that a lot of guidance is very similar. So whichever guidance you choose to follow, you'll be perfectly fine. This particular review looked at this particular issue, and Duncan Thomas from Northumberland this morning reflected the view there is a lot of consistency about the advice. So the point about this is if you follow the advice that's out there, the toolkit, there isn't a huge amount of inconsistency. So what guidance should I follow? Well, if you're an NHS practice, the starting point will be the CDO's guidance. This does, of course, create challenges for mixed practices in all 4 nations, as we've heard today. These challenges are ethical and legal and contractual and can cause serious issues for practices trying to deliver care to their patients. You'll have heard Sarah Hurley says that she trusts practices. So hopefully she does. She trusts practices. The conversation she had with Leah, she expressed that quite clearly. In respect of are we allowed to see routine patients, it's a common question that seems to be arising from a number of dentists phoning up the BDA. The answer to the question, this is very England specific, am I allowed to see a routine patient do checkup? The answer in England is a resounding yes. This was made clear in the 28th of May letter, and you can see that the expectation was that there would be a gradual, there's an intention to stage that progression back to full work, and those that could do AGPs were free to do so, and return to checkups when it's safe and appropriate to do so. So practices aren't impeded from doing checkups and doing routine care. The intention was always going to be trying to ensure that they did so having done the urgent care, done the incomplete treatment before going back to it. But certainly checkups are possible for in England. The difficulty, of course, is that it's not necessarily reflected in the other countries, because in Scotland, they're in phase 3 with non-AGP continuing possibly till mid-August. In Wales, there is also a phased approach, which has also been taken, unlike England. So England is pretty unique in saying from June the 8th, you can go straight back to work. The other devolved nations have a completely different point. And as Dave alluded to earlier this morning, Northern Ireland has a particular problem. 20% abatement is a financial crisis facing Northern Ireland dentists, as indeed for many other parts of the UK, but they have exactly the same problem about going back to work. There's no immediate going back to work. There's a phased approach as well. So that creates problems. It creates a problem for the BDA advising dentists. It creates problems for indemnity organisations as well, advising dentists. They need to know which country they're in before they actually can give advice. And the good thing about the BDA is the updates from Martin give you a very clear guide on that. The other issue is the primacy of guidance. And a lot has been discussed today, and the issue really is that at the moment, when it comes to what PPE to wear, infection protection and control, fallow times, fit testing, it is PHE and its equivalents in the other developed nations. Ian Gordon has spoken passionately about this lack of evidence around PHE guidance this morning and on his tweets. If you follow him, I agree absolutely that there's no evidence, but the problem is this is the guidance, and when it comes to following the guidance, it unfortunately has to be PHE and its equivalents in the other countries. So there's much concern about getting it wrong. What is the GDC going to say? Well, you should be reassured to know the GDC is actually leaving it up to you. They say we have no interest in penalising well-grounded professional judgments on how best to meet patients' needs, including whether judgments to reduce activity or provide no activity at all. So it is interesting that the GDC have taken a pretty clear view for the first time in a long time. And they say it's up to you to exercise professional judgment and weigh up the risks. And you might argue, well, the GDC has a pretty sad and sorry reputation for many years in the past, and not dealing very fairly in the past with dentists. But I think most commentators, anybody, an indemnity organization dealing directly with the GDC now, will recognize they're a completely different organization, and they have a better idea, hopefully now, of what should and should not progress, and what indeed was considered to be serious in terms of fitness to practice issues. So I think you should be reassured that the guidance from the GDC is true and accurate and following your risk assessment. So I think you need to worry less about the GDC than you probably did in the past. So what if I get it wrong in relation to CQC? Well, CQC and its equivalents in the developed nations also leave it to individual practices to set up their own standard operating procedures based on national guidance, and they're leaving it largely to you to decide on what you're going to do. Again, it's risk assessment based, and ultimately the decision to offer dental care is up to you, and the CQC is regulating the practices, not individual dentists working in that particular environment. So again, it's a risk-based approach. In the end, the evidence for the quality of your care, the decisions you make, the consent you get will be found in your records. And the reality is complaints, claims, investigations may arrive long after COVID is over. And so your records are important. You will have forgotten exactly what you did at that particular time. So it's really important that you have good records. All of you know what good records look like. I'm going to spend a great deal of time, but you need to think about the possible future challenges to you in respect of this. So the challenges are going to come in relation to consent, what options were given. Sometimes they may be limited by what PPE you have at the practice at a particular time. What PPE you're wearing may also be relevant to a claim that they got COVID in your practice. And again, those are quite important things to look at when you're actually looking at records. So by all means, look at your records and change your template to try and reflect those particular risks. If you get it wrong, you'll be looking for support from your defence organisations, and in some cases the support will be on a discretionary basis. You've been seeing adverts during the day about that, demonstrating the differences between them, and discretionary basis mean you may or may not get cover. In other cases, contractual cover via an insurance contract will assure you that if it's in the policy, it's going to be there, and it's contractual. Will my indemnity cover me for fit testing? Conference today has raised this issue about fit testing. BDA indemnity will cover the policy holder as well as the staff of policy holders if they are a practice owner. Those fit testers who've been trained through the scheme being rolled out in England through HE, Health Education England, will be covered by Crown Indemnity through an honorary contract. And this will cover any fit testers, whether they're registered or not. And this honorary contract will terminate automatically on the 31st of March 2021. I'm going to finish on one particular point, which has raised a number of issues. An increasing problem faced by practice owners, vicarious liability. Patients' lawyers are now looking to hold practice owners responsible for the actions of self-employed associates, as well as foundation dentists and employed staff. And whilst we accept vicarious liability is common with employees, receptionists, dental nurses, it's less of an issue. It's less commonly attributed in terms of self-employed people. But this is the action that's been taken by particular dental practices, dental solicitors. These are sort of letters that dentists are now starting to get when they are holding a practice owner directly responsible for any negligence carried out by clinical staff, and they spuriously quote a number of cases which aren't necessarily relevant. If you are a BDA indemnity policyholder, it's clearly in the policy. We've made it very clear the wording is in the policy, so because it's in the policy, you'll be covered for vicarious liability for any actions going forward in relation to treatment that has been provided, not necessarily by you, but by somebody else in the practice or duration of your policyholder. With BDA indemnity, you'll be covered. Those of you who are BDA members will have got this in the last couple of days, and Kevin Lewis has written a detailed guidance on it. Last plug basically is get a quote. You won't know how much it costs unless you get a quote. So please just go online. It's on the BDA website. Get a quote online. It'll tell you how much it costs. It'll be depending on whether you're doing implants, what country you're in. It's actually cheaper in Scotland. If you're a practitioner or an associate, your year of graduation, the number of hours you work. You do have to be a BDA member to be eligible for it. So practice owner's got to be the expert tier, associates in the extra, and NHS employee will be essential. So thank you very much, Leah, for giving me the opportunity to address the conference. I think I've kept to time, despite the number of slides I rattle through. There are, hopefully, if there are any issues, I'm on, continue to be on. So if you want to put in the chat bar, I'm more than happy to answer those questions. Thank you very much, Leah, and enjoy the rest of your conference.